We communicate on behalf of and for all the medical interns in the country as resolved.
In a meeting held on 1st June 2021 between President Yoweri Museveni, Federation for Uganda Medical Interns, Uganda Medical Association, the Minister of Health and the Minister of Finance, Planning and Economic Development, a resolution was passed that medical interns be paid half the salary of entry for their respective fully licensed and service-employed professional cadres. This was later reaffirmed by the President on 9th August 2021 through a letter to the Prime Minister in consultation with the Minister of Health and Finance to implement this directive starting July 2022. However, the Minister of Health on 27th July 2023 issued a directive of paying each medical intern a net monthly payment of 1 million shillings. Under the umbrella Federation for Uganda Medical Interns, they have threatened to lay down their tools effective February 1st, 2024 on account that the Minister of Health breached the presidential directive as regards to their pay.
On 1st of February, all medical interns in the country will lay down tools because of failure of government to respond to the breach in this presidential directive, and all our efforts that have been made in the past and that had gone into waste are not responded to. And this will stop until the government clarifies its position.
Yola banyamba the stethoscope, empiso, simanyi giravu, byonna tugenda kubyambula okuvanga 1st of February 2024 paka ngazine ensonga zonna zetwogeddeko wammanga.
Led by their President Bill Adrati, these have called upon President Museveni to rescue them, saying their situation is so alarming.
There is an opportunity to fix the future, and we call upon the government to organize all the relevant authorities to ensure that they respond decisively to reinstate the presidential directive.
Muline eggwanga ani alina obusobolozi obujemere ekiragiro ky'omukulu President His Excellency Saabalwanyi, tugamba twagala abatunyonyole ate tugamba omukulu aveeyo alabe kwabo ani ajemere ekiragiro kye.
Adrat also demanded an answer to 3 major questions of what statutory instrument was used to alter the presidential directive to the current figure, the person who approved and endorsed the payment, contrary to the position of the president, and whether the president is aware of this alteration.
Discovered very many unanswered questions, and these questions were as follows. 1. What statutory instrument was used to alter the presidential directive to the current figure which was communicated in the press release? Who approved and endorsed this current payment contrary to the position of the presidential directive P003 that has been in implementation since July 2021? Is the President, His Excellency Museveni, aware about this abuse that represents a position contrary to his vision towards a competent healthcare system and promotion of sciences?
Dr. Ramadhan Musiho, the site leader Mlago Hospital, called for the ongoing budgeting process for 2024-2025 financial year to consider the forthcoming medical interns after this court so as to avoid future challenges.
Mu parliament, budget etuse ku budget framework paper. Era kuliko ne budget plan ey'omwaka. Tubadde tusaba nti omwaka ogujja tebefuula mbu ate tetwategera mbu bayintani bajja kubeerawo. Babeere nga bakwasa ensonga y'okubeera nga bakola budget eyo, babeere nga ssente z'abayintani baziteekamu, ate ssente nambukulufu ddala eza presidential directive, bayintani abalijjamu obwo obudde basaye nga ssente zaabwe ziri mu budget ate nga zisasulwa mu budde.
However, Emmanuel Inebiona, the spokesperson for the Minister of Health, says they reached the solution of 1 million shillings per month due to financial constraints, and a clear notice was made in reference.
Why did we assign them an allowance of 1 million? It is because there is not enough budget to cover up their allowances given their ever-increasing numbers. So, in consultation with His Excellency the President, we were advised to pay them an allowance that fits within the resource envelope available, and that's how we ended up with 1 million net.
He condemned the planned industrial action and advised them to concentrate on their internship and create room for others.
I can only advise them to concentrate and finish up their internship, enable them to get practicing license to be able to operate as licensed doctors. And that is all I can call and ask out of them, because we expect another cohort which has been patiently waiting home.
John Baptist Ahumuza, Church of Uganda, Family TV News at 8.